MedShake. Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. For the first time ever, a study has rigorously tested a fully automated generative AI chatbot called Therabot as a tool for treating serious mental health conditions. The findings, in a word, promising. Let's unpack what this really means. Welcome into the Meta Health. The study in question was just published in the New England Journal of Medicine AI, and it's causing quite a stir. Conducted by researchers at Dartmouth College, it's the first randomized controlled trial, that's the gold standard in clinical research, to evaluate whether a generative AI chatbot can effectively treat symptoms of depression, anxiety, and eating disorders. That's a bold claim, right? But the data holds up, and we're going to break it down together. The researchers enrolled 1,205 adults who had been diagnosed with major depressive disorder, generalized anxiety disorder, or an eating disorder. Participants were randomly divided into two groups. One got unrestricted access to Therabot, and the other was placed on a wait list, meaning no chatbot for them during the trial. Therabot isn't just a glorified chatbot. It uses generative AI technology grounded in large language models, yes, the same kind of tech that powers ChatGPT, to engage users in deeply human-like conversations. But it doesn't stop there. The model was fine-tuned with therapist-written scripts based on evidence-based practices like cognitive behavioral therapy, acceptance and commitment therapy, and dialectic behavior therapy. Throughout development, clinical psychologists and psychiatrists were actively involved to ensure the quality and safety of the interactions. Over an 8-week period, researchers tracked changes in mental health symptoms using clinical tools, questionnaires, and scores. So what did they find? By week 8, people using Therabot showed statistically significant improvements across all 3 clinical domains. Depression symptoms decreased by a mean of 1.49 points, more than those in the control group. Anxiety symptoms saw a mean reduction of 1.36 points. For participants with eating disorders, there was a smaller yet meaningful reduction of 0.38 points. These changes were measured over 8 weeks and reflect clinically meaningful improvements, especially given that the intervention was fully automated and unsupervised. Now, you might think these numbers sound small. And yes, the effect sizes were categorized as small to moderate. But here's the twist. They were clinically meaningful. In mental health care, even small improvements can make a big difference, especially when multiplied across thousands or millions of people. So what made this so unique? Let's talk about something called the therapeutic alliance. That's the trust and bond between therapist and patient, often a make or break factor in therapy outcomes. In this study, users rated their alliance with Therabot at 3.63 out of 5. That's in the same ballpark as traditional in-person therapy. So yes, people knew they were talking to an AI. And yes, they still felt understood, supported, and engaged. Users typically spend around 2.3 hours with Therabot over the entire 8-week period, in short but frequent sessions. That's a usage pattern that mirrors how most of us interact with our phones, and that's part of what makes this model so scalable. But let's zoom out a little bit. Why is this such a big deal? First, access. Millions of people globally can't access mental health care due to cost, geography, or stigma. Therabot doesn't need a therapist on the other end. It's fully automated and can run on a smartphone. This means help could reach people in rural areas, underserved communities, or simply those who are not ready to see a human therapist. Second, scalability. Mental health professionals are in short supply. AI chatbots like Therabot won't replace human therapists, and they shouldn't, but they can serve as a first step, a supplement, or even a triage tool to identify those who need more intensive support. And third, engagement. The fact that users formed real therapeutic bond with a chatbot challenges a major assumption, that only human interaction can provide emotional support. For some users, this low-pressure, judgment-free interface might actually be more comfortable. But what are some of the limits? The study authors are clear. Therabot isn't a cure-all. It's not a substitute for care in complex or severe cases. There are still open questions around data privacy, long-term efficiency, and how to best integrate this tool into existing care systems. Ethical questions loom large. Who gets access? Who monitors misuse? How do we prevent over-reliance on bots when human connection is needed most? And let's not forget, this was an 8-week study. We don't yet know how long the benefits last or how Therabot compares to other digital interventions. So where do we go from here? The study is a landmark, but it's just the beginning. Future research will need to look at diverse populations, different conditions, and longer timelines. And as AI technology evolves, so will too the design and intelligence of tools like Therabot. But for now, this is a massive step forward. It's early, but robust evidence that generative AI can not only deliver therapy, but also do so in a safe, effective, and meaningful way. So that's it for today. I will see you soon for another tech adventure in healthcare.